nurse, and I'm an associate professor at the Ontario Tech University in Oshawa, which is in Ontario, and this is close to Toronto. So this morning I have the pleasure to moderate this session, and I have the pleasure to introduce our first speaker, and her name is Yuanyuan, and she's going to be talking about the predictors of turnover intention among pediatric nurses in mainland China, a national study. Thank you.
Good morning, everyone. I'm very glad to have this opportunity to give a presentation in this wonderful Congress. I'm Yuanyuan. I come from Peking University School of Nursing, China. Today, I would like to share with you about the topic, predictors of turnover intention among pediatric nurses in mainland China. I will introduce my study through these aspects. First, let's look at the background. With the rapidly growing population in the world, the shortage of nurses and the high turnover rate of nurses has become a global issue. According to the literature published in Lancet in 2014, the acute shortage of pediatricians and pediatric nurses has worsened over the past decades. Chinese government began to implement the two-child policy since 2015. This policy has increased the demand for pediatric health resources in China. However, the turnover rate is high in China. According to the data from the Scholar Town, we can see that in Eastern China, the turnover rate of nurses is 18%. We don't have the national data about the turnover rate among pediatric nurses. We can see that in USA, the turnover rate among pediatric nurses is 13%. Pediatric nurses are high-risk group of turnover because of the low income. They are highly pressured working conditions and difficulty in communicating with the demanding parents. So how to prevent the turnover is very important. High turnover rate can aggravate the shortage of nurses, cause the loss of valuable human resources. It also can disrupt the ongoing activities, for example, reducing the enthusiasm of the in-service nurses, impacting the clinical care negatively. And turnover intention has been identified to predict the turnover. Turnover intention is the immediate precursor to actual turnover. It is defined as a probability that an employee will leave his or her job within a certain time period. To understand the turnover intention can help us foresee the possible turnover and take measures in advance to prevent the turnover. Currently, there's no study investigating the turnover intention among pediatric nurses in mainland China. So our study aims to assess the turnover intention among this special population is a high risk of turnover. population. And I also want to identify the predictors of turnover intention, and thereby we can provide some suggestions for health administrators to take some measures to prevent turnover. Therefore, we conducted this cross-sectional study. We recruited the pediatric nurses in mainland China to participate in our study. We used the convenient sampling to recruit the participants. We conducted the online questionnaire survey, and the pediatric nurses responded to our survey voluntarily and anonymously. The measures in our study we used as following: the social demographic information, the turnover intention, the job satisfaction, organizational commitment, work stress, job burnout, work family support, and professional identity. The job satisfaction is evaluated by a single item to ask the nurses the degree they are satisfied with their job. And other measures, except for the demographic statistics, are all evaluated by the questionnaires which have already been widely used. Next, let us look at the results of our study. Totally, there are 6,673 pediatric nurses included in our study. They are from 28 provinces or municipalities. We can see that most of them, about 85% of them, are from the tertiary hospitals. This slide shows us the social demographic statistics of the participants. From the graph, we can see that the yellow part represents the highest proportion. We can see that most of them are with a bachelor degree. They are senior nurses, and about half of them are reporting they have average level of family economics. And about 60% of the participants are from the general hospitals and are married. This slide shows us the turnover intention. We find that about 10% of the participants are with an obvious turnover intention. Then we do a further analysis. We find that the pediatric nurses who are from the general hospitals, who are the senior nurses who reported bad family economics and who are divorced or widowed, have a higher turnover intention than others. Then we do a correlation analysis. We find that the factors related to the turnover intention included the age, years of service, income, and night shift amounts. We also analyze their job satisfaction and its association with the turnover intention. From this graph, we can find that about 9% of the participants are very unsatisfied with their job. About 31% of the pediatric nurses reported that they are not satisfied with their current job. So we can see that it's a high proportion of the pediatric nurses are not satisfied with their job. And from this graph, we can see that the lower satisfaction with the job, the higher turnover intention. Then their work stress is in an average level, and the work stress is also related to the turnover intention positively. How about the job burnout? We can find that their job burnout is also at an average level. And among the different dimensions of the job burnout, the emotional exhaustion is the most serious problem among these pediatric nurses. And the job burnout is also related to the turnover intention positively. The professional identity of these pediatric nurses are also at average level, which is also related to the turnover intention negatively. Then we also analyze their organizational commitment. Their organizational commitment is at a medium level, and it is also related to the turnover intention negatively. The pediatric nurses reported lower organizational support and the leaders' support, which indicated that the insufficient support from the organization is very low, is the very important problem. And we can find that the work-family support is also a contributing factor to the high turnover intention. Then we used structural equation modeling to analyze the predictors of turnover intention. We can find that the job burnout has a direct positive effect on the turnover intention. And the organizational commitment and the job satisfaction also have a direct effect on the turnover intention, but these effects are negatively. Other two measures, the work stress and the work-family support, have the indirect effect on the turnover intention. From these results, we can conclude that it is important for the administrators to consider how to protect nurses from high turnover intention. Additionally, it is necessary to pay attention to pediatric nurses' job burnout and work stress to improve job satisfaction and organizational commitment, and to provide them sufficient support to avoid the turnover intention. That is what I want to share with you. Thank you.
Thank you very much. Any question? If you have a new question, we're going to invite, thank you very much. I'd like to invite our next speaker, which is Samantha Chia from Singapore. Come on in. Who's going to discuss the factor associated with midwives' work-related stress and burnout, an international integrative review. You got your 10 minutes.
Thank you. Ask me for strength, and I will lend not only my hand, but also my heart. I'll start over. Ask me for strength, and I will lend not only my hand, but also my heart. Good morning, ladies and gentlemen. My name is Samantha, and I'm from KK Women and Children's Hospital. I'm a registered nurse and a midwife working in the labor ward for the last 10 years. Today, I will be presenting my integrative review on the factors associated with midwives' work-related stress and burnout. I chose this topic as it is one that is close to my heart. While there has been studies done on burnout in nurses, there has been no integrative review so far done on midwives as an individual group. Throughout the last 10 years, I have seen fellow midwives leave the profession due to reasons such as stress and burnout, and in all honesty, I myself have harbored similar thoughts. But thankfully, I am still here and still very honored and proud to be a midwife. Today's presentation outline includes the background of this integrative review, the aim, methodology, main results, and conclusion. Midwives are the primary providers of care for childbearing women across the globe. For a long time now, there has been a shortage of midwives globally, and this has negative implications on both mother and newborn. The literature review identified burnout and work-related stress as significant factors associated with attrition and shortage in midwives. Burnout is a serious problem with consequences ranging from a reduction in quality of care, increased attrition rates, and to the development of psychosomatic issues and even suicide. The aim of this review was to synthesize all the available evidence on factors associated with burnout and work-related stress in midwives. Accurately identifying and understanding these factors will assist in informing future strategies and policies by healthcare leaders and administrators, improving the retention and recruitment of midwives. The framework of this integrative review was guided by Whitmore and Nuff, which included the 5 steps of problem identification, literature search, data evaluation, data analysis, and presentation. Through a search of 5 databases, 584 initial records were identified. 270 papers remained after duplicates were removed. After applying the inclusion and exclusion criteria, the screening of the records on the basis of title and abstract, 24 full-text articles were assessed for eligibility. Of these 24 papers, 7 were removed as their outcomes did not state any factors associated with burnout and work-related stress in midwives. A final selection of 17 papers were included in this integrative review. 16 were qualitative cross-sectional studies and 1 a qualitative phenomenological study. 4 of the studies were set in Australia, 2 in the United Kingdom, and another 2 in Slovakia. The remaining studies were set in various countries such as Croatia, Japan, Sweden, New Zealand, Belgium, Norway, Denmark, Turkey, and Senegal. The themes that emerged from this review included the risk factors and protective factors of burnout and work-related stress. These risk factor themes included aspects of midwifery work, organizational factors, socio-demographic factors, emotional intelligence, and interpersonal conflict. Aspects of midwifery work appeared in 8 of the 17 papers. The constant need for engagement, interaction, concentration, and attention by the midwife can lead to a qualitative job overload, especially when dealing with distressed women. This often leaves midwives feeling themselves emotionally distressed and drained. Midwives in their daily work of caring for women may encounter events they perceive as traumatic, such as stillbirths or incidents during the process of labor where mother and child were at risk of death or serious injury. As a consequence, midwives may develop similar symptoms to post-traumatic stress disorders. Death and dying of a patient or her child was cited as the most stressful experience for midwives in Slovakia. Another aspect of midwifery that contributed to burnout and work-related stress was shift work. The findings indicated that working the night shifts were considered to be the most stressful, while other papers indicated that it was the mixed day and night shifts that led to lower personal accomplishment scores. This variance could be due to a difference in the number of working hours or even staffing levels during various shifts, which was not explicitly stated in the papers. Organizational factors appeared in 7 of the 17 papers. The lack of work resources, which includes the shortage of staff, is a major cause of concern for midwives and was directly linked to high levels of stress and cited as a reason to leave the profession. Inadequate remuneration was highlighted as a significant factor of stress. Midwives expressed that as a result of the management's poor practice, a wall of silence had been created around the topic of burnout that prevented early recognition and timely intervention. Socio-demographic factors were acknowledged in 6 of the 17 papers. It was found that burnout is associated with age and work experience. Midwives aged 35 years or less were 2.4 times more likely to experience burnout compared to those older than 35. Midwives without children were more likely to suffer from burnout as compared to those with children. It was argued that the commitment and motivation that single midwives put into their work may not have been balanced with a life outside of work. The number of years in the profession also had an effect on burnout and work-related stress. Midwives with less than 10 years in the profession were more likely to experience burnout than those who had spent a longer time working as a midwife. These newly qualified midwives may find a workplace that is hierarchical in nature, medically dominated, lacking a woman-centered approach, and providing limited opportunities for them to use their abilities. The theme of emotional intelligence was identified in 4 papers. Midwives who had higher levels of empathy were found to be associated with higher post-traumatic stress, which placed them at a higher risk for burnout. Midwives often start off with a deep passion for being a midwife, and it is this same passion that has the potential to skew professional objectivity. The midwife often puts a woman's needs first, sometimes at the detriment of her own health. The lack of support from peers and the management meant that midwives often felt isolated in their experience of stress and burnout and harbored feelings of personal failure. Midwives described feelings of shame and being unable to meet what they perceived to be the professional expectations of their midwifery role. The theme of interpersonal conflict occurred in 4 of the 17 papers. Interpersonal conflict with doctors was rated the second most stressing factor for midwives in Slovakia. It was found that younger midwives with a higher level of education were more likely to be involved with conflicts with physicians than their older colleagues. This could be attributed to the new education models, standards of midwifery hospital care, and legislation that allowed midwives a considerable degree of increased autonomy. Conflicts with working colleagues and managers were among the reasons cited by midwives who considered leaving the profession. 7 papers had identified protective factors for burnout and work-related stress. Midwives who had spent 21 years or more in the profession experienced the most joy working as compared to those with less experience. This might relate to the fact that experience relates with increased competence, and these midwives had learned coping skills and were more satisfied with their achievements. Midwives who were married or a cohabitant and aged 60 years and above reported less burnout. Having children and a life outside of work reduced levels of burnout and was also a coping strategy for burnout. Engaging in scheduled exercise and learning to pace oneself both within and outside the workplace was shown to be therapeutic in managing stress. Caseload midwifery was also identified as a sustainable model of care in that caseload midwives experienced lower burnout scores compared to standard care midwives. A frequent positive aspect of this model of care was the flexibility, being able to decide how to work, and the ability to work reduced hours, which is cited as a protective factor for burnout and work-related stress. In terms of job control, caseload midwives were more likely to have autonomy over decision-making affecting their work, such as their workload and working hours. The study in Turkey found that midwives who perceived that their colleagues had positive opinions of the midwifery profession had lower levels of work-related stress and increased job satisfaction. Midwives who felt that the management or organization was committed to helping them maintain a work-life balance reported lower levels of burnout. Midwives want to be involved in the decision-making and support from the management in promoting the awareness of burnout. In conclusion, after this integrative review, my department, we have implemented flexible work arrangements such as working part-time, which currently 6% of our departmental staff are doing, and also staff who have teamed up and done alternative shifts, meaning one staff takes the morning shift and the other does the opposite afternoon shifts. The hospital also has channels for midwives to report disruptive work behavior, and the management supports midwives by listening and acting on feedback. Mental wellness is advocated for in the department, and the hospital hosts regular exercise activities such as Zumba and yoga for all staff, which also helps to promote bonding between staff of all levels. Debriefing sessions are held after particularly stressful situations at the workplace, and midwives are encouraged to share their experience. The hospital also provides professional help from trained counselors for staff. After doing this integrative review, it was evident that more research is needed on the topic of burnout and work-related stress, especially on our local population of midwives in Singapore. While a longitudinal study is costly, it will be valuable in evaluating the relationship between risk factors and the development of burnout in midwives. With that, I would like to thank you for your time and attention today.
Thank you very much. Any question? Okay, there's a question for you, Samantha. Okay, we have, speak loud because otherwise we won't be able to hear you.
Thank you for your question. So you are asking where the interpersonal conflict with doctor arises from? Yes? Okay. So in my department, in my experience, and when I've done my research with this integrative review, it is often when the midwife offers a different diagnosis or opinion from that of a doctor, that's when the interpersonal conflict arises, and then there is a clash in opinions, and the midwives often have their opinions squashed. And so then they feel that they haven't been heard and they weren't able to provide the care that they wanted to give to the patient. Yeah.
Thank you very much. I would like to invite Gillian McCorkell from United Kingdom, who's going to be discussing Project Retain, improving recruitment and retention of nursing staff in older people's wards. It's all yours.
Good morning. My name is Gillian McCorkell, and I'm a nurse with the Public Health Agency in Northern Ireland. Northern Ireland is part of the United Kingdom and has a population of 1.8 million. It is situated in the northeast of the island of Ireland and shares a border with the Republic of Ireland. Health and social care in Northern Ireland is public funded and provided by 5 health and social care trusts. Project Retain commenced in June 2017 and was funded by a grant from the Burdett Trust. Today, I'm going to share with you the project's journey, and I will do my best to try and enlighten you on what we did, how we did it, and most importantly, what we have achieved. Throughout the world, people are living longer. It is estimated that by 2020, the number of people aged over 60 will outnumber the population of children younger than 5 years old. With these growing demographics, patients are likely to have multiple comorbidities, causing an increase in demand for health and social care services, resulting in a demand and need for knowledgeable and skilled nurses. But we also know globally that there are issues and problems with the recruitment and retention of nurses, and this is particularly evident in older people's settings. Nursing in this area is often perceived as the Cinderella of nursing, and not as exciting or interesting as nursing in other areas, such as emergency or critical care, with limited development opportunity for nursing staff. If we are going to have a nursing workforce that is competent, skilled, and motivated to care for our ageing population, we need to do something different to move forward, because if we always do what we've always done, we'll always get what we've always got. The session earlier this morning has emphasised and demonstrated the impact of both recruitment and retention and the impact on healthcare. So our key aim of the project was to increase nurse recruitment and retention in care of the older people settings across our 5 health and social care trusts in Northern Ireland. The project had 5 objectives that encompassed all members of the nursing workforce who have a role to play caring for older patients, from pre-reg nursing students to ward managers. 10 wards were selected across the 5 health and social care trusts to participate using an agreed criteria that included evidence of issues regarding recruitment and retention of staff. project was funded for 18 months and, as I said earlier, commenced in June 2017. So the first 6 months was really the groundwork and setting the scene. And also we collected some baseline data, which was both quantitative and qualitative in nature. The quantitative data included staffing figures such as the number of vacancies and turnovers of staff in the previous 2 years. The qualitative data included an observation of practice, values clarification exercise, and a nursing workplace satisfaction questionnaire. The baseline data then also informed a training programme that was delivered from January until September 2018, and then from September until December saw the collection of endpoint data, a celebratory event, and the writing and publication of the final report. Objective 1 focused on our nursing students to promote positive experiences so that they would choose to work when training was completed as a registered nurse in that area. We employed a number of different initiatives, but in essence of time today, I've highlighted the main contributor. AGNI is the largest charity organisation within Northern Ireland dedicated to helping everyone make the most of later life. Utilising a co-production model, volunteers from the charity became peer facilitators and engaged with second-year pre-registration nursing students in Northern Ireland's 3 universities, sharing their experiences of active ageing. This initiative was a great success and enabled the future nursing workforce gain an insight, hear stories, and learn from people who had a lifetime of lived experiences. We also completed a survey of third-year students who had just completed their training to determine how many of these graduates chose to work as a staff nurse in older people's wards. Pre-project, this was just under 13%, and post-project, I'm pleased to say, had increased to 16%. Finishing university and starting employment can be a stressful or challenging time, making the transition from student nurse to registered autonomous practitioner. The demands of the new roles can lead to dissatisfaction. Objective 2 was to provide a support mechanism for newly qualified staff. Retain and encourage the trusts to tailor their induction and preceptorship programmes to include aspects on clinical topics that are applicable and appropriate to older people's settings. However, it was the non-clinical elements that were equally as important in today's challenging ward environments, and we provided 5 regional workshops on the topics resilience, mindfulness, and assertiveness. Feedback showed that the staff found these extremely beneficial and felt that staff should be given the opportunity to attend this as part of induction programmes. Objective 3 was aimed at both registered and non-registered nursing staff to provide opportunities to develop their career in older people's nursing. The baseline data collected identified the training needs of staff. It gave staff a voice that was listened to. And for unregistered staff, the data in some of the wards indicated that the nursing assistants did not feel included or valued as team members. We listened to them and we worked with them to address their issues and concerns. Retain also contributed to the development of an older people's nursing career pathway that can be accessed now on the Northern Ireland Practice and Education Council's website. Objective 4 was to provide staff with a pathway to help them feel supported, engaged, and appreciated. Topics covered included leadership workshops for ward managers and senior staff that aimed to support, enhance, and develop existing leadership skills and qualities. Workshops were also provided to support and enhance the development of future leaders, and these workshops highlighted the need to address the leadership role regionally as a development issue to enable succession planning. And again, peer facilitators provided a series of action learning sets with staff across all wards on topics such as active ageing, dementia, and communication from a service user's perspective. The final objective was aimed at staff who, like myself, are nearing retiring age, to offer a range of health-promoting strategies in order to retain their raft of skills, knowledge, and expertise. We provided a series of regional workshops entitled New Beginnings to explore retirement from a variety of perspectives. And these are some of the suggestions that the potential retirees felt were opportunities for them to share their experiences instead of just retiring and taking all their knowledge and skills with them. So what has the project achieved? The observation of practice pre-project revealed a lot of good practice, but also highlighted some issues that the wards involved developed strategies and solutions to address. This exercise was repeated post-project, and the results revealed consistency in the wards that had demonstrated exemplary practice at baseline, but most importantly, all the wards had a calm atmosphere displaying truly person-centred care and communication to patients and their families. The Workplace Satisfaction Survey carried out examined the intrinsic and extrinsic factors influencing nursing staff satisfaction. The higher the score, the less satisfied. And as you can see, there was improvement in staff satisfaction in 8 out of the 10 wards. The other 2 highlighted some issues from the staff that the trust concerned have developed an action plan to address. What about the staffing levels? Well, pre-project, there was approximately 47 vacant Band 5 staff nurse posts across the 10 wards. Post-project, this has improved significantly to only 16 vacant staff nurses posts across the wards, which shows an improvement of 66%. We asked the staff on the ground what actually Project Retain did for them. And if you notice from some of these quotes, they actually felt that they were listened to. Your opinion mattered to the ward and made care for patients better. We have a number of recommendations, but due to the limited time today, I can't go into too much detail. However, a copy of the full report can be downloaded. So, in conclusion, Retain has appreciated, given status to, and valued the nursing staff within our older people's wards. It has ensured that the voice of older people has supported the development of a competent, stable nursing workforce for the ageing population. We will continue to share the learning not only in the care of older people's hospital settings, but in all care settings across Northern Ireland. And this is just some photographs taken during the project and at our celebratory event. And thank you for listening.
Thank you very much. If we have any question, I will invite anyone to go to the microphone. Well, thank you very much. It was very good. Thank you. Now I would like to invite our 2 next speakers from Denmark, Helle Folden and Annette Larsen, who are going to be discussing the factors influencing retention of experienced nurses in medical wards, a qualitative study using tabletop simulation to collect data.
Well, thank you very much, and thank you for being here, listening to us, and we appreciate very much the opportunity to be here. We are going to talk about exploring factors influencing retention of experienced nurses in medical wards. Medical wards in the capital region of Denmark have been challenged for years in terms of recruitment and retention of experienced nurses. It could have, and we have heard a lot about that this morning, this have serious effects on patient safety and quality of care. Almost no attention in the capital region of Denmark is paid to ways of retaining highly qualified nurses who are directly involved in patient care. Therefore, developing programs for retained nursing with more than 2 years of experience can have a positive impact on staff turnover. It can also have positive impact on the level of professional competences and ultimately on the quality of care that our patient receives. My name is Helle Folden. We both, Annette and I, we're coming from the Copenhagen Academy of Medical Education and Simulation in the capital region of Denmark. We are working with education every day, and our primary learning method is simulation-based learning, which also are used for data collection in this study. Furthermore, I facilitate nurse leaders' reflection on how to create a productive learning environment in the daily clinical practice as a project manager.
Hello, and I'm Annette Larsen. I work with education and learning processes, mainly with postgraduate nurses and doctors in the hospital setting. I'm responsible for developing and teaching courses for both graduate and experienced nurses, where we train interprofessional teamwork.
The purpose of this presentation is to contribute with aspects from experienced nurses' perspective, especially which factors that support their decision to stay in the medical wards. We will talk about what is important in their daily working life. How can they feel acknowledged in their working life as a whole? And we will also talk about what is the advantage of using tabletop simulation to collect data. It's probably new for most of you. And how can tabletop simulation enhance facilitation or reflection? Finally, we will inform you about the most surprising results.
On the picture you can see the setting of our tabletop simulation, how it looked in our case. It's very low-key. It's a plastic tablecloth with a drawn road representing a path through an average day of work and spare time for the nurses. The artifacts representing the nurses' home, workplace, were made by Lego bricks. And as you can see on the first arrow, this was supposed to be representing the homes of the nurses. And the second arrow is showing where the hospital is. And then our third Lego construction is supposed to look like the ward where the nurses do their, where they work. You can also see on the picture it's full of post-its, and you can see the written doors where it's supposed to, where it should describe where the nurses go through to the ward, and then how also where they leave the ward and return to their home. We did 4 steps of the preliminary analysis, and the first step was to do some individual reflection. To further the mindset of the starting point, we were asking the details from their everyday life, such as their way to work and how their thoughts were before entering the department. To stimulate the participants' individual reflection, we asked the participants which thoughts they had before entering the department. At every station, we asked the nurses to write their thoughts and reflections on post-its without sharing the information among each other. They had different colors, maybe you saw in the other pictures. Each nurse has each their color. And the purpose of this was partly that so they didn't influence each other's, and also both to include both the introverts and extroverts individuals. The second step, they jointly, both us, the facilitators and the participants, were sharing reflections and discussed all the post-its where they have been writing their reflections. The second step, we gathered all the themes, all the topics on a flip over. And then on the fourth step, the participants were to decide themselves which 3 topics they were to prioritize. And then at the end of step 4, we were discussing and analyzing all the topics, or the 3 topics between the participants and ourselves. The advantage of using this method can create a recognizable environment for the participants and stimulate several senses. In that way, we can ensure they have the same focus at the same time, because we ask the question referring to their everyday life and the artifacts, thereby activating their tactile senses.
After the tabletop simulation process, Annette and I went home to conduct a qualitative inductive content analysis inspired from Ilo and Kyngos. We did it in a very classical way, and you could probably see that at the monitor. First, we did an open coding separately, the two of us, and then a discussion of the meaning behind the quotes. We call this process the paraphrasing. Afterwards, we grouped all the categories in a higher order, and finally we did the abstraction process and gained 4 general themes with several sub-themes. The analysis process gained 4, as said, general categories: competency development, organization, professionalism, and work culture. You now will get some points about the sub-themes. You can see the competency development, and the sub-themes were structure, knowledge sharing, supervision from specialists. Experienced nurses want to develop their professional skills even though they're already on a high level. They want a structure in their daily working life for how to develop their professional competences. And they sometimes feel lonely because they are often the only one who has the high level of competences, and they miss sharing knowledge and to be supervised by specialists. So our reflection can be, should we go home and make a structure on how to develop skills and competences for nurses with a high level of competences? And could that provide more retainment for nurses with high competences? And maybe we should get some more specialists and bring them into the clinical practice together with patients and experienced nurses. The theme organization had some sub-themes as well: visible leadership, a competent organization of daily tasks, and balance between work and private life. Experienced nurses want to be involved in organizational issues. It's important that the organization of daily tasks are well organized and that the leader's perspective is known by everybody. It's also important that the work plan takes the private life in consideration, and we know that. It's not new, and we are aware of that. Professionalism, the sub-themes were high level of professional competence and deliver care with high quality. That's really important. The experienced nurses know how to deliver good care, and they get very frustrated when it's not possible. They desire very much to feel professional. They also desire to be in an environment where the quality of patient care are being discussed every day in their working life. So we should strive and discuss and reflect on patient care every day. About the theme work culture, the sub-themes was how to be acknowledged, expectations to role models, and relation between colleagues. Experienced nurses don't only want to be acknowledged for gaining more formal education or being project managers, but evenly for taking care of patients. They want to be acknowledged for taking care of patients. They feel that the organization expects them to always take care of the patients with the highest level of complexity and simultaneously be a good supervisor for newly appointed nurses. They feel stress about they're feeling stress about their duty as good role models. So our reflection was, is it possible to give them a little space, and how important it is not to take them for granted? It leads us to this quote. An experienced nurses told us that, I feel like giving and giving, but when do I get something in return? Maybe we should think about, what do we have to give them back? And do we have the things that we need to give them back? Probably don't. But what is the cost if we don't give them anything? we have to reflect on that.
And then our surprising result, the big gap. During our analysis, we found a lot of well-known facts, like Helle already said, about recruitment and retention. The high work pressure, lack of staff, low salary, working hours, and etc. But what became very clear to us is how many resources we spend in the capital region of Denmark on introduction programs and competence development for graduate nurses and newly appointed staff, and how little we spend on retention for experienced nurses. Fortunately, this became clear to the management as well, and a lot of initiatives has been started. For example, the Nurse Leaders Reflection and courses for experienced nurses in clinical decision-making and other initiatives. But we believe that this area needs great attention because we think there is a big potential in investing resources and on developing programs in how to retain experienced nurses, just as we know programs for introduction of graduates. And we could assume that if we develop programs for retention, we could spend a little less resources on recruitment. Thank you.
Any questions for two speakers? Thank you very much. Okay, now I'd like to invite Junhong Zhu from China, who's going to be discussing understanding population in Chinese nursing retention, two different perspectives from nursing directors and the nurses who left nursing practice. It's all yours.
How can it bigger? It's just smaller, right? Okay. Thank you. Dear nursing fellows, my name is Junhong from China, Zhejiang University. I'll talk about understanding power relations in Chinese nursing retention. Two perspectives from nursing directors and nurses who left nursing practice. I will briefly introduce the background, research aim, question method, but mainly will focus the theory developed from the study. Then the significant issue for nursing intention will be discussed. The study is located in Zhejiang province, the eastern part of China. The picture shows the capital city of Zhejiang province. There's 25 tertiary hospitals with 44 colleges and universities in this capital city. So the ratio of registered nurse to population in Zhejiang province and the level of nursing education is quite higher than national average. The table shows the reality of nursing shortage in China is more serious than that in many countries. Normally, Chinese nurses in day shift, one nurse need to take care of 14 to 45 patients. Several surveys indicate more than half nurses express their intention of leaving, while in reality, not many nurses in China left clinical care. In nursing workforce management, wastage is a measure of lost. Turnover always look at two sides. One side is lost, and one side is additions. And because definition of turnover is not always consistent and clarified. And the comparative statistics study-based use turnover measurement didn't provide effective communication and understanding of Chinese nursing mobility. Well, our research aim is to understand why nurses leave the nursing practice in China. Our research question is, how do nurses experience and perceive their situation from recruitment to final exit? How do nurses explain the reasons for their leaving nursing practice? It is a grounded theory study, theoretical sampling, and constant comparative analysis continue nearly 10 years, which include a daughter study project, interview with nurses, 19 nurses who left nursing, and the study implementation follow-up interviews with 28 nursing directors. Well, our findings, the storyline of mismatch the expectation indicates how nurses' career decision progress towards leaving impact the safety and quality of health care. Well, individual and organizational expectation mismatched. Whether nurses will stay on leaving depends on their perception of power. This includes nursing autonomy versus medical dominance, professional value versus managerial value, personal freedom versus organizational control. Powerless nurses are effective nurses. In our study, we found powerless nurses, when they feel mismatched is very high, they will stay for life. And nurses with high perception of power, they will voluntarily leaving. Well, based on this close tabulation of core concept, or theoretical suggest, well, the higher mismatched expectation between individual and organizations, and the more imbalanced of power they perceived to ensure the quality of health care, the more likely the nurses will choose to voluntarily leave. As I said, powerless nurses are effective nurses. In this, the low perception of power, nurses will passive stay for life, and the new nurses with less power, they will use adaptive staying. So we clarify the definition of wastage should include not only look at how many nurses left, but also should include passive stay and adaptive staying. So we think if we want to achieve an effective nursing workforce management, we need to focus how to let nurses active stay. What the theoretical explanation helps. In 2013, this theory is provide a way to understand and communicate the problem of Chinese nursing mobility with the policymakers. And our theory is provide to the Provincial Nursing Association negotiate with Financial Department, Human Resource Department, and Health Authority. We are quite successful increase salary and night shift allowance for nurses, about 100 to 800 yuan per month for each nurses. And most successfully, the government decided provide full retirement with 100% salary for the nurses who reach health service in clinical care 13 years. That's a very good model for the all nationwide now. And because in 2004, we met a lot of nursing directors, and a follow-up study to understand one dimension of power is managerial value versus professional value from nursing director perspectives. Oh gosh, sorry. And the significant issue is the majority of nursing directors regard academic pursuit as an essential role of nurses, which include doing research projects, publish lots of academic papers, organize the regular academic conference. It's quite an academic way to do their job. And the reasons for pursuing academic achievement for the manager is because it is meet the requirement for hospital administrator evaluation, support nurse professional development, and most important is meeting the requirement for career programs and promotion. This table shows all Chinese career paths, and if nurses want go the career land, they need to publish lots of paper, do research project. This is a huge burden for ordinary nurses. I cannot go to detail because of time limitation. I interview a nurse director. She's excellent work and working very hard. Always want to do the best for their hospital and very proud of being #1 in the province in every perspective of nursing professional activity from competition, examination, academic achievement. However, the nursing director said that she has a low quality of life. I don't have time, always working off-duty time, even working on weekend. So I asked him, how about nurses? So she talked about we provide many learning chances for young nurses. We do very good teamwork, very well welcomed by the nurses from other hospitals for learning. And she thinks their hospital nurses are very capable compared to others. However, this hospital have 200 nurses left together. So while academic efforts push nurses to leave, from my previous study, nurses explained why they left. They said, academic requirement didn't help me develop both professionally and personally. I had to quit, find a meaningful life. So actually, other people talk about, do you believe that tired staff can work effectively? I had to quit as I lost confidence in ensuring the safety of care. The consequence of academic orientation from management perspective is greatly shape the way of using resources, information, opportunity, and support to meet academic evaluation as a priority. Discourage nurses' enthusiasm in bedside care, increase discrepancy between nurse academic achievement, patient safety, and nurses' job satisfaction. Nurses lose grounded concerning power if they lose confidence in value of what they do. So remember, we talk about when nurses lose the confidence in safety or quality of care, nurses have some problem to stay. The challenge faced Chinese nurse leadership is how to do the right thing in a right way. A key research Professor Les Change said, a key aspect of nursing manager role is to create a work environment conditions that empower nurses to provide the best possible care for their clients, patients, according to their professional standards. So we need to avoid wastage. We need to reduce the mismatch expectation between individual and organization. We also need to empower nurses to ensure safety and quality of care. So I wish our dear nursing fellow take away the definition of wastage. We need to provide the best care with the active stay workforce. Thank you. Because the time limited, I could not go to detail. We publish 9 papers. If you are interested in the theory or more detail, you can go to my publications. Thank you very much.
Thank you very much. For the interest of time, I won't take any question, but the speaker will be able to stay maybe after. Okay? So I'd like to invite Pi Hai Hong. She's from Singapore. Come on in. Oh, I didn't say it right, eh? Singaporean nursing student perception of a career in community nursing. You're welcome.
Okay, hi everyone. My name is Pei Yi and I'm from Kurik Prat Hospital. So today I'll be sharing with you a study entitled Singaporean nursing students' perception of a career in community nursing. And this study was done as part of my honours project. So with that, I will start my presentation. I would like to give acknowledgement to my project supervisor as well as collaborator. Okay, so as we know, aging population and the changing disease profile have resulted in the transformation of healthcare model. So from the hospital-centric care towards community-based care in order to meet the emergent healthcare and social needs of the population. And so this translates to a growing demand for community nurses. But the problem is that there are few nursing students in Singapore aspiring to pursue a career in community nursing after their graduation. And according to the World Health Organization, community nursing refers to a nursing specialty that hinges on a person-centric, population-focused, and community-oriented approach of designing and delivering nursing care in any settings outside the acute care facilities. And in the context of my study, this encompasses a diverse spectrum of nursing subspecialties, including home care, primary care, public health care, hospice care, palliative care, as well as intermediate and long-term care. So the main objectives of our study is to explore undergraduate nursing students' perception of a career in community nursing, as well as to identify strategies to promote community nursing among the nursing students. And so a qualitative exploratory study was conducted involving a purposive sample of 24 undergraduate nursing students from a Singapore university. And four focus groups were conducted, and all the interview transcripts were all analyzed using thematic analysis. And so we have 4 key findings. So the main themes, 4 main themes are midlife career, limited career progression, a difficult career transition, as well as an international nurses-dominated workforce. Moving on to our first theme, midlife career, we have a lot of students who mentioned that they regarded community nursing as a midlife career option for them. So one of them shared that, now that I'm still young and energetic, I need the fast-paced work while I can still handle. I will consider community nursing when I'm a bit older, when I need to settle down. Not only that, some of them also highlighted that they feel intimidated to pursue a career in community nursing after they graduate because of the lack of experience as a fresh grad. And this is especially if they were to go into areas of home nursing. In our second theme, which is limited career progression, it is agreed among our participants that career progression is an important consideration among the undergraduate nursing students. And many of them, they felt that if they were to, go further into nursing, they feel that community nursing is not the place that they would want to start their career because they feel that there is limited opportunities for them to advance further and also for the professional growth. Yeah. Many of them also had this perception that acute care nursing will provide them with better opportunities for advancement, and then because of the availability of learning opportunities in the setting. And so one of them shared that I have this fear that my learning will die down and I wouldn't learn much anymore if I go into community nursing. I wouldn't benefit from it. In our third theme, which is a difficult career transition, many of them saw added difficulty in transitioning from community nursing to acute nursing, whereas they perceived relative ease in transitioning from acute to community nursing because of the skill set difference. And because of that, one of them shared that after working in an acute hospital, you can definitely go into community nursing because they need your skills. They want you. But if I started out from community care and I want to move towards acute care, would they really still want me as much? In our final findings, we found out our students actually identify an international nurses-dominated workforce within the community sector. So one of them said that there are a lot of foreigners. It's like working in a foreign country. It's very different. I wouldn't say that I don't like to work with foreigners, non-locals, but I would like to have a good balance of everyone. In the last, a majority of them also pointed out that because of the, a lot of them felt that the people that were working in the community nursing were usually not by choice. So because of the attitude and the image that was portrayed to them, so it affected their perception of community nursing and also their experience there. And so one of them said that people working in the community hospitals, half of the time it's not a choice that they make, but a place they were thrown to. That's why you see a lot of foreign nurses who are not passionate about their jobs, not even motivated to teach. A lot of students don't gravitate towards community nursing because of the very impression that they are creating. And this actually highlight to us that because of these negative past experiences they had during their community posting, it actually dissuaded the students from joining community nursing as a profession. So moving on to our discussion and implication. So our findings suggest that a lot of students actually prefer a fast-paced work environment while they're still young, and then because they want the adrenaline rush. But when they are older, they feel that they are ready to settle down or they have different priorities in life. So only then they verbalize that they would want to settle down and step down from acute setting to community nursing. And so, Yeah, so, and also they felt that clinical experience as well as skill set maturities were the requisites for them to work in community care settings. So as such, we feel that new graduate nurses should be allowed to work in acute care settings for a predefined period of time and to gain experience as well as to develop their skills. Only after that, then transition them back to the community nursing. And another thing is that because in our local context, right, at present, actually a lot of the nursing curriculum are still emphasizing on acute care rather than community care, and so educational and health institutions need to work together to create a more diverse and meaningful opportunities for students to expose themselves to community nursing. So for instance, they can be allowed to rotate between the different community subsectors to gain experience of what it is like to work there. And then so in our second and third theme, right, we actually know that career prospects and career mobility are pivotal consideration in the student's career decision. So most of them have the impression or the perception that community nursing has a bleaker and narrower career path, and so they were deterred from joining it. And in Singapore, we have a very generic nursing career framework for the nurses, but most of them felt that it's not very clear in the sense for the community nurses. So what we suggest is to foster a multi-directional developmental framework for better career prospects and for greater career mobility, so as to allow the nursing students or the existing nurses to transit between acute and community nursing. And then also, there is a lot of misconceptions surrounding community nursing, and this actually highlights the lack of understanding towards the profession. And so we need to illuminate community nursing career pathways to bring clarity to the variety of roles, educational requirements, as well as the potential career opportunities and nursing career education advancement available for community nurses. Okay, in our fourth finding, which is an international nurses-dominated workforce, we noticed that a lot of them actually said that they had a bad experience during their community postings. And so this highlights the importance of having positive preceptorship and role models within community sector. And as such, this can, so having the bad experience can actually affect them in terms of their intention to join community nursing, as well as to affect their preconception of community nursing. So it is important to identify, find ways for to promote a culture of teaching and learning within community nursing, and this will help to enhance students' learning experience, and and having role models within the field can actually help motivate and inspire students to join the profession. So finally, our study also suggests that cultural difference could be a reason why participants felt marginalized within a community dominated within an international nurses-dominated workforce. So a lot of them use the word foreigner, right, in their during the discussion. So this actually highlights the inadequacy and the cultural competence of our nursing students, as well as the existing workforce. So a lot there are more work that needs to be done to improve the cultural competency of our existing workforce, as well as our nurses, our students. So in conclusion, there is a need to foster an optimistic career outlook and mobility in community nursing to entice nursing students into the career track. So strategies to enhance community nursing recruitment includes providing more quality and diverse community placement opportunities, implementing a clearly defined career developmental plan to elucidate the role of community nurses, as well as to improve community care and cultural competencies to develop a skilled and diverse nursing workforce. And I'm very happy to say that my study was recently published in the International Nursing Review. So for more detail of the paper, you can read the article. Yeah. Okay, thank you.
Thank you very much. I'd like to invite our next speaker, Ms. Chia, who's going to be discussing the relationship among social support, empathy, resilience, and work engagement in Chinese hemodialysis nurses. And we have another speaker after, so stay tuned. Hey, don't go yet.
Dear colleagues, good afternoon. It's my pleasure to stand here to share my research. And I'm a nurse from Hemodialysis Center in West China Hospital, which is located in the southwest China. So if you want to see candor, go to the research place. So my research have focused on the relationships among social support, empathy, resilience, and work engagement in Chinese hemodialysis nurses. It's well known that the rising aging population, the increasing prevalence of conditions such as hypertension, diabetes, obesity have led to the increase of hemodialysis patients around the whole world. And unlike nurses, in general words, hemodialysis nurses are usually employed in a highly stressful technical workplace in which nurses need to operate complicated dialysis machines on their own and deal with various disease and dialysis-related complications. Nurses also play critical role in delivering dialysis therapy and assume various roles when the patients enter the dialysis units. Furthermore, nurses are required to build long-term therapeutic relationships with patients over several years until the patient die or receive a kidney transplantation. So, the technical challenges in the workplace, the complicated dialysis procedure, and the nursing and client relationship have led to the increased job stress and burnout and reduced career satisfaction and retention rates in hemodialysis nurses. From the literature review, we found that work engagement is an important workplace health index, which refers to a motivational process involving absorption, dedication, and vigor. And prior studies have examined work engagement among nurses in diverse hospital wards or special areas, but no previous studies have emphasized work engagement as its predictors in hemodialysis nurses. The job demands and resources model have provided a framework for our study. Firstly, it emphasizes that job resources might be helpful in achieving job goals and facilitating personal growth. Secondly, job resources such as social support and autonomy might promote work engagement. And finally, personal resources, for example, resilience and personality, have positive relationship with work engagement. So, based on the framework, we have hypothesized. Firstly, social support as a job resource is positively associated with work engagement. Secondly, empathy as a personal resource also have a positive relationship with work engagement. And finally, resilience also as a personal resource is positively associated with work engagement. So, the aims of our study were to describe the levels of work engagement in Chinese hemodialysis nurses and to analyze the relationships between social support, empathy, resilience, and work engagement. This was a cross-sectional descriptive study, and a total of 345 hemodialysis nurses in 17 hospitals in China were included. And the instruments used in the study included perceived social support scale, Jefferson scale of empathy, resilience skill, and work engagement skill. Meal service was carried out from September to December in 2016, and the statistic analysis methods used in our study included descriptive, creational, and hierarchical regression analysis. These were our results. From the table. We found that male nurses reported significant higher work engagement score than female nurses, and there were statistic differences in work engagement scores among nurses with different occupational tenure and educational level. And finally, single, divorced, or widowed nurses reported significant lower work engagement scores than married nurses. The findings of correlation analysis indicated that each domain of social support and each domain of empathy were significant positive associated work with each domain of work engagement. And the positive and significant relationship between resilience and engagement in work were also demonstrated in our analysis. The findings of hierarchical regression analysis showed that in the first step, after demographic data were included in our study, only sex and occupational tenure in hemodialysis units had significant predictive effects on engagement in work, which explained 6.8% of the total variable. In the second step, after the demographic data were controlled, we found that resilience, other support, and perspective taking were significant contributors to work engagement, with the explained variance increased by 41.4%, and the predictive effect of sex and occupational tenure were still significant. In our study, we found that Chinese hemodialysis nurses reported a moderate level of work engagement. In comparison with developed countries, China experienced a more severe nursing shortage, and nurses in China have heavy workloads and need to serve a high percentage of the patients. And Chinese nurses have less chances to receive adequate rewards, for example, professional promotion, income, and respect from their workplace in comparison with nurses in Western countries. We also found that resilience was the strongest contributor to work engagement. It's known that hemodialysis units is characterized by a technical workplace in which nurses need to operate complicated machines independently and deal with various dialysis-related complications. So, high levels of resilience can help nurses in stress coping and positive adjustment when exposed to workplace stressors. It was found that support from others have positive, significant predictive effect on work engagement, and other support refers to that from co-workers and nursing managers. So it's important to facilitate supervisor and colleague support in the workplace, where hemodialysis nurses work in future studies. It was also found in our study that perspective taken have led to the increased work engagement. It has been reported that the patients receive dialysis therapy 2 to 3 times each week for 4 hours or longer, and the frequent communication between nurses and the patients can provide adequate chances to develop great nurse and patient relationship and understand the patient's experience in depth. So understanding of the patient's experience from their perspectives can help nurses in recognizing the needs from the patients and providing needs-based care, which can further facilitate patient satisfaction. On the contrary, positive feedback from patients can lead to positive attitudes. Conclusions. In our study, we have found that, firstly, hemodialysis nurses reported a moderate level of engagement in work, and work engagement is primarily affected by high levels of resilience, followed by support from others and perspective taken. Secondly, nursing policies should be developed to develop supportive work environments and to support the training of resilience and empathic capacity to facilitate work engagement. And finally, training programs, for example, Mindful meditation training and empathy skill training have been recommended for nurse managers to facilitate resilience and empathic capacity in nurses. Thanks for your attention. If you have problems, sir, or if you want to further information, my paper also have been online published in International Nursing Review. So thank you very much.
Thank you very much. Our last speaker is from Australia, and it's Joe Mapes, trailblazer in recruitment and retention, delivering innovative recruitment pathway to ensure a secure future workforce.
Thank you for the opportunity to present our work here today, ICN, and thank you to all of you for being here during your lunch break. Before I commence, I would like to acknowledge my colleagues from Eastern Health, the learning and teaching team, and the nursing midwifery workforce leaders, as well as my colleagues in human resources, who all contribute to the success of these programs. So today I'm just going to give you a brief introduction to our health service, the background and challenges which have brought us to where we are today, and outline some of our workforce strategies that have proved to be successful in meeting our recruitment and retention challenges. I'll also share with you where we're up to and some of our future plans, and perhaps some questions at the end. So Eastern Health is located in the eastern suburbs of Melbourne. We're a mixture of urban and rural populations. A few pictures there for you. We deliver approximately 1.2 million episodes of patient care every year, and we serve a primary catchment of 774,000. Our services stretch across 2,800 kilometres out through the ranges to the east of Melbourne, and we employ over 9,000 staff and about another 1,000 volunteers in our services. Nurses and midwives make up 50% of our employed staff, and about 62% of them live locally. So we work out of 7 main hospital sites, but we also operate over 50 facilities. So our challenge in meeting the workforce gap really took hold in 2015. The predicted shortages that were reported by Health Workforce Australia are well upon us. We have an ageing workforce, as you've heard already in the conference. Many of our nurses are advancing in their years, and we do have nurses working into their 70s. We have high graduate numbers qualifying from universities, and we have high applicants for our graduate programs. But we do not get good responses from experienced and postgraduate qualified applicants when we attempt to recruit, particularly to specialty areas. Our main areas of challenge are mental health nursing, midwifery, and our critical care areas. Because of the range of programs that we have to support patients leaving hospital, the patients who are actually in our beds are really sick. Our workload demand is high, our patients have much higher acuity and are much more complex. Anybody who can be nursed at home is discharged very quickly onto hospital in the home or the post-acute care programs. So those that are still admitted are very unwell. We also know that when we have a non-regular workforce, so that's use of agency nurses in particular, it does lower the morale amongst our regular staff. So in 2015, we developed our workforce strategy to reduce agency, to fill our EFT vacancy, and to improve retention in nursing and midwifery across the health service. One area we worked on was for the unregistered workforce. This was to attempt to create new pathways and to support our qualified workforce. We conducted a pilot in 2014 of the health assistant in nursing role, which was then mainstreamed in all acute areas in 2015. In 2017, we attempted to recruit registered undergraduate students of nursing, or RUSONs, to work in our subacute services as assistants in nursing. This pilot proved to have several challenges, not least limited availability of the students due to university and placement commitments, but also a very different expectation of the role, with many of them seeing it as extra placement hours and were not committed to a contract of employment. So we continue to employ Certificate 3 trained nursing assistants through local training providers. These staff are supernumerary, they are over ratio staff. Their position description is dictated by our Department of Health, and they all follow the same duty list under the supervision of our registered nurses. They're now embedded in the workforce, in our acute wards and on pool, and this additional staffing has really improved morale and job satisfaction amongst our qualified workforce. We've also seen improved patient outcomes across a number of nurse-sensitive indicators, and many of our health assistants have now gone on to complete their enrolled nurse and registered nurse training, so it's been a very good entry level for them. We have a two-tier nursing system in Australia, so we have enrolled nurses who also are supervised by registered nurses. They undertake an 18-month diploma in nursing. We have high numbers of enrolled nurses registering and applying for roles, but we discovered that they were not necessarily ready to enter straight into the workforce on qualifying. They needed a lot of support to transition and a lot of upskilling. So we developed a 6-month transition program. This includes study days, clinical education, bedside assessments and appraisals. And this has allowed us to directly recruit enrolled nurses into our wards. This model has been showcased by the Department of Health and has rolled out to metro and regional centres. It's been very successful. Our graduate programs have expanded into new settings in recent years. We've seen significant growth and we now have over 220 graduates in our system. We've developed blended programs and a broader number of settings to give our graduates exposure to specialty settings. Our graduates are put onto permanent contracts when we employ them, not just for 1 year. We know we will need them in our workforce, and this has allowed us to achieve a 96% retention rate. We've seen an increase in applicants of 25% in the last 2 years from both domestic and international graduates. We have a fellowship with Deakin University, which means those students in the fellowship program, which is now in its 4th year, are taught by Eastern Health educators and come to Eastern Health for all of their placements. So they're very ready to be very good graduates for us at the end of their RN training. This has also seen an increase in interprofessional practice placements, a partnership with La Trobe University for Allied Health and Monash University for medical students, with Deakin students of nursing, all coming together to manage patients in a shared ward area as an interprofessional team. Our early career nurse program was developed in 2018 and runs in parallel with our graduate nurse program. This is really a second chance for nurses who have graduated in the last 3 years, but for a number of reasons have not been able to access a formal grad program. They come to us with limited or no experience. Some of them have not even entered the nursing workforce and have been selecting to go into jobs in retail or hospitality because they haven't had the confidence to undertake nursing. Equally, there are those who have joined nursing agencies with very little support and have really floundered clinically. They must have working rights, so they must be a citizen or a permanent resident of Australia. And this is a 12-month contract with 2 rotations, supported by a team of clinical support nurses, clinical assessments, study days and appraisals. And then our HR team work with them to transition them into ongoing employment. And this has been a really successful program. The formal evaluation is currently underway to compare the outcomes compared to a formal grad program. Our RM Refresher program is probably one of our biggest success stories, introduced in 2015 and now in its 5th year. This is an opportunity for us to recruit experienced nurses back into our workforce. We have 3 to 4 intakes each year with 12 to 15 registered nurses in each intake. This is a 200-hour program which includes 40 hours of study day and 160 hours of placement. These learners are supernumerary. We don't pay them, but we don't charge them. They run through a preceptorship model, and they undergo appraisals and a transition interview at the end of the program, which runs over 8 to 10 weeks with the option to do full-time or part-time. I'm pleased to say 92% of our refresher nurses have been employed into a variety of roles and settings, including ANUM roles, educator roles, and community nursing. This program has also been showcased by our departments and has been picked up by other networks. And we have recently expanded this into a midwifery refresher program also. And we've had 2 successful groups through the midwifery program. The last program I want to share with you today is our supervised practice and international transition. This is quite unique and also very effective, and there is a growing demand for placements in this area. The Nursing Midwifery Board of Australia will sometimes apply a condition for supervised practice. After screening these conditions, we will develop an individually tailored program. This also is applicable for students who have undertaken the International Transition Program, and it aligns closely with our early career nurses. These are supernumerary unpaid positions, and we don't currently charge any fees. And a lot of the referrals for this program come from our association, the Australian Nursing Midwifery Federation, for nurses who are trying to get re-registered, who've had a break in employment or a break in practice, usually between 5 and 10 years. There's several ongoing employment options at the end of the program, and this is really a new area of focus and recruitment for us. But it has allowed us to find some very experienced, skilled nurses who have very quickly been able to regain their confidence and their clinical competencies and rejoin the workforce. So just in summary, all of this work has been done at no cost to the health service. It's been a huge commitment of time and effort from the nursing midwifery leadership team and our educators, but it has allowed us to continually top up our recruitment throughout the year. These programs are now embedded and have proved to be sustainable. We have reliable processes and onboarding systems in place, and all of the screening and allocations of these staff are centralised to ensure consistency and a high standard. This has allowed us to really build our reputation as an employer of choice, and has also allowed us to consistently sustain an agency rate of less than 5 EFT, which is one of the best performing health services in Melbourne. So what's next for Eastern Health? We're continuing to develop our postgraduate pathways and scholarships, including nurse practitioner candidacies and advanced practice roles in fields such as endoscopy and cystoscopy, and a nurse-led PIC service coming on board in the next 6 months. We've worked up a rural partnership with Alexandra District Health to offer a shared graduate program and a staff rotation, and shared learning platforms and education. And we're now implementing the changes to our ratios through the Safe Patient Care Act, with many wards having an increased staffing uplift through the 2018 tranche of changes. Thank you.
Thank you very much. I know this is the final speaker. If anybody had any questions, the speakers are still here. Otherwise, I want to really making sure we applaud all of them for their great work, and we learned a lot.